Good morning, everyone. I am delighted to welcome you all to the Boston Club's 2021 Community Salute. This is our 22nd Community Salute and our very first virtual one. My name is Nancy Nader, and I am honored to be president of the Boston Club. Thank you all for being here with us this morning. For those of you who may not be familiar with the club, we are an organization of over 600 senior professional and executive women about to celebrate our 45th year beginning this June. While we are diverse in myriad ways, we are united in our shared commitment to the advancement of women's leadership in an inclusive society. We believe that having more women in significant and visible leadership roles has a positive effect on business results, organization success, and our society at large. We are here to support women in their ventures and in reaching their goals, and we are especially focused this year on advancing women of color in the boardroom. The Community Salute is one of the Boston Club's signature events. We hold it to celebrate women who dedicate their time, funds, and counsel to community organizations and to the advancement of women. And we walk the talk. We are a force for change. Over 400 Boston Club members serve on the boards of over 500 nonprofits of all sizes. And over the club's history, we have helped over 300 nonprofit organizations find qualified women to join their boards. We are proud of our reach across the broader community, particularly as it involves diverse racial and economic populations and support for women and girls. You will hear more about that work in just a few minutes. I would like to thank and recognize the sponsors who, by supporting this morning's event, are helping the Boston Club to advance our mission. I'd like to especially recognize, though, and thank our supporting sponsor, Blue Cross Blue Shield of Massachusetts. Thank you to them. And also our contributing sponsors, Alchemies, American Tower Corporation, Boston Scientific, Cummings Properties, EY, Eastern Bank, Liberty Mutual, and She & Finney. I hope you'll take note of all the organizations that have sponsored today's event. And remember that companies sponsoring the Boston Club share our commitment to diversity, equity, inclusion, and the advancement of women's leadership. Please join me in thanking them all. We have a terrific event for you this morning. I know you'll enjoy meeting and hearing about our Advancement Award recipients, the companies receiving the first President's Awards, and the work being done by our panel of extraordinary healthcare professionals. Welcome again to the Boston Club's 2021 Community Salute, and thank you so much for coming. And we hope to see you in person in 2022.
Good morning, everyone, and welcome to the Community Salute. I'm Åsa Fanelli, and I chair the Boston Club's nonprofit board committee. Our committee manages one of the club's major initiatives, increasing gender diversity on nonprofit boards. We have a group of talented, committed members, many who are here with us today, who serve on our committee, and I'm incredibly grateful for all that they do to support our mission. The Nonprofit Board Committee promotes and supports women for membership on the boards of directors of nonprofit organizations and governmental agencies. In the past year, we have assisted a wide variety of incredible mission-driven organizations that were seeking new directors with specific skills and expertise. We have completed 12 successful board placements. And currently, we have 15 open board positions posted on the Boston Club website. So if you are interested in serving on a nonprofit board, we encourage you to contact us through thebostonclub.com. Our committee members would love to talk with you and to find the right match. The Nonprofit Board Committee also offers educational programs that support board member service. Our speakers cover topics such as governance and fundraising responsibilities, as well as other relevant issues facing nonprofit board members today. We design programs both for experienced directors as well as those who are new to this and want to explore what nonprofit board service is all about. In fact, just this month, we are beginning a 4-part series called So You Want to Be a Nonprofit Board Member. The first event in the series starts on May 17, and you can find more information and register to attend on the Boston Club's website. Our committee also supports the Community Salute by honoring nonprofit community organizations that have made major contributions in improving the lives and opportunities for girls and women. It is a great pleasure for me to be presenting the 2021 Advancement Award. Since 1995, the Boston Club's Advancement Award has honored 43 organizations in Greater Boston that do meaningful work to advance the status of girls and women. And through this process, we have been able to raise awareness, to highlight, and to recognize many amazing nonprofits. I really want to thank the members of the Boston Club who nominated qualified nonprofits for the award. And I encourage all of you members to participate in the process in the future. This is an annual event, and there are many wonderful organizations that could really use our support and assistance. And also a special thanks to all the members of the Advancement Award Committee who have the challenging task annually of selecting organizations to receive this award. I tell you, it's always very difficult to choose the winner. In 2020, the theme of the award was focusing on or providing creative programs that support women as they seek to access fundamental healthcare services. And when we reviewed our Advancement Award nominations, there were 2 organizations that really stood out and most closely aligned with that mission. Last year, as you know, the Community Salute was canceled due to COVID. And we decided then and there that we would honor and recognize the same 2 organizations again in 2021, because they really deserve the public attention. The Boston Club's Advancement Award comes with a gift of $5,000, and therefore, over the 2 years, both these organizations will have received $10,000 each. So it is with great pleasure that I announce that the 2020 and 2021 Advancement Award goes to Emira Inc. and Healthcare Without Walls. Our winning organizations are both awe-inspiring. I'll tell you a little bit about them, and then we'll hear from them directly. Emira's mission is to provide refuge for those seeking to break free from exploitation and heal in community on their journey toward hope. Emira was founded in 2011 by a group of individuals who are seeking to join the anti-sex trafficking movement. And through connections with law enforcement, the group decided to meet the greatest need for survivors in New England, which is aftercare recovery. Every year, hundreds of thousands of people are trafficked in the United States. And of those, approximately 71% are females. Most victims of sex trafficking in New England are from the United States. And the chances of finding a new life of liberation and freedom for these victims is slim due to the lack of resources and support. Emira is changing that for New England by offering every woman that comes into their home individualized, trauma-informed, and whole person care. The program works through 6 avenues of whole person care, helping them to recover through their physical, their emotional, mental, social, vocational, and spiritual trauma. And Emira has one of the highest success rates in New England area in working with this population. And it's actually credited by the Homeland Security. The Advancement Award will provide funding for women who enter into their Safe Home program on the North Shore of Boston, and to provide them with health insurance and to gain access to medical and mental health services that are absolutely vital. Now, joining us to accept the Advancement Award for Emira is their CEO, Stephanie Clark.
Thank you so much, members of the Boston Club. We at Amira are truly grateful for your support and this award to help advance the cause of women who want to exit the cycle of exploitation and find empowerment on their journeys of liberation. Just this past week, we were able to help a woman find new trauma therapies that are meant to help her in her work of recovery. Thank you for helping us to do this work, and thank you for being a part of finding journeys of hope for every single woman that comes into our care. Hope truly does live here.
Congratulations, Stephanie, and thank you for all that you and your colleagues are doing to change the lives of women. Our second Advancement Award recipient is Healthcare Without Walls. Their mission is to improve the lives of women who are homeless or marginally housed through compassionate, high-quality healthcare, education, and advocacy. Healthcare Without Walls was founded by Dr. Rosanna Means in 1999. Women experiencing poverty, violence, and homelessness are extremely vulnerable and present unique needs. Healthcare Without Walls provides free walk-in care in shelter clinics where its clients can feel really safe. In 2019, they provided over 7,300 visits of bridging medical care and support services to 1,300 homeless women and children in Boston. In 2020, the shelter-based wellness clinics were forced to close, but Healthcare Without Walls was able to see over 1,000 women who visited Rosie's Place, screening guests for COVID before entering the shelter. And just this week, they opened their very own wellness clinic in Boston, where they're happy to welcome women back for in-person care. Healthcare Without Walls has developed 2 signature programs to support pregnant, postpartum mothers and the elderly. The 2 programs, Bridges to Moms and Bridges to Elders, combine immediate healthcare provided by a nurse practitioner and intensive case management provided by a community health worker. They work together to address key social determinants, including housing and food and transportation, access to healthcare and safety. There is vast evidence supporting the achievement of improved health outcomes and cost savings when social determinants of health are addressed. Both Bridges programs address these social determinants in part by providing vouchers for meals and taxis. Taxi vouchers are critical means for providing access to medical appointments, which makes all the difference for promoting maternal and child health, as well as improving health outcomes for elderly women. The gift cards help these vulnerable women to access items they otherwise wouldn't be able to get, such as a car seat or a winter coat or even diapers. The Advancement Award will be used to help fund these programs. Please join me in welcoming Healthcare Without Walls founder, Dr. Rosanna Means, who will accept the Advancement Award. We should note that Dr. Means also accepted this award in 2004, just 5 years after founding the organization.
Hi, I'm Dr. Rosanna Means from Healthcare Without Walls, and I'm here with this absolutely spectacular award from the Boston Club, the Advancement Award that recognizes Healthcare Without Walls for the work that we do with women and girls in the Commonwealth. I want to thank you so much for this recognition. Healthcare Without Walls, which used to be called Women of Means, has been on the front lines for 21 years, helping women and girls who are homeless, housing insecure, about to be evicted, some of them living in cars or on the streets. We close the gaps in care for women who are out there, not able to connect to healthcare services, roaming the streets. They're scared, they're dealing with mental illness, they're dealing with chronic diseases, and we have a medical team of nurses and community health workers and volunteer doctors who are right there, ready to help them every day of the week when they need us. We've been doing this for 21 years, and we plan to be doing it for the next 21 years. In the last 10 years, we developed 2 special programs. One is called Bridges to Elders for women who are 55 and older, and sadly, that number is increasing. And also another program called Bridges to Moms for women who are pregnant and getting maternity care at Brigham and Women's Hospital, where I'm on staff. and who have no place to take the baby home to. We provide help with housing, transportation, food sources, and personal safety, and a lot of tangibles, such as grocery store gift cards, Target gift cards, meal tickets for the Brigham cafeteria. And we also give the women who are going home with their babies strollers, cribs, bassinets, diapers, layettes, all the things they need to start a new life. I'm really proud of our clinical team that has been there for these women all these 21 years, and especially during the pandemic, where we were there at Rosie's place every day, screening the women for COVID, making sure they were safe and had a place to come into during the day to get away from the exposure, the streets, the fear, and the stress. But the most exciting news for us is that we're about to open our first freestanding independent clinic. We've waited a long time for this clinic. It's located in downtown Boston. It'll be the first time we have our own place where the women can come in and be seen by our extraordinary staff and get the kind of compassionate, loving care that we're so good at giving these women. It'll be open next week, 5 days a week, and we can't wait to welcome these women back and to give them the kind of dignity, respect, and compassion and love that we've been giving them for all these years. I want to thank the Boston Club for giving us this extraordinary award for recognizing the work of Healthcare Without Walls so that we can continue to help these women and give them a better future and the better health that they deserve.
Thank you so much, Rosanna. I'm sure everyone here today joins us in congratulating both of these wonderful organizations. We are so very grateful for all the extraordinary work you do to support women in need. Thank you.
Good morning. I am Rita Allen, the past president of the Boston Club. The Boston Club's mission of advancing women leaders is only possible because of our partnership with leaders in the business and nonprofit communities. The support of these partners is extremely valuable to us and very much appreciated. The Boston Club identifies, recognizes, and showcases organizations that are leaders in supporting the advancement of women in the C-suite and boardroom through our annual census reports. We also realize there are organizations that do not meet the specific census research methodology, yet have consistently demonstrated leadership in advancing women in their organizations. I am extremely excited to announce a new initiative to recognize such organizations. We are presenting the Boston Club President's Recognition Award this year to 2 organizations that have supported the Boston Club over the years and shown leadership in advancing women leaders within their own organizations, consistent with the mission of the Boston Club. Our original plan was to present this award live for the first time at our 2020 Community Salute during my term as president, but were deferred by the pandemic. And I'm delighted to now be able to present this award to 2 deserving organizations. It is my great pleasure to honor Blue Cross Blue Shield of Massachusetts and Alchemies as the 2 recipients this year. Blue Cross Blue Shield of Massachusetts and Alchemies' priority of creating an inclusive and diverse organization is foundational to their core values and goals. The number of women on their boards and executive management teams, as well as within their workforces, is exceptional in representing that priority. They are leaders in the advancement of women and are continued supporters of the Boston Club. Most importantly, they exemplify that commitment in their practices. And for those reasons, we believe Alchemies and Blue Cross Blue Shield of Massachusetts are worthy of this honor. Please join me in congratulating Alchemies and Blue Cross Blue Shield of Massachusetts as I present this honor to them. We are extremely grateful for your partnership and very much look forward to continuing our partnership for many years ahead. Thank you and congratulations.
Thank you. It is an honor to join you here today at the Boston Club Community Salute. The Boston Club does such important work in advancing women and supporting our communities. It is a particular honor to receive this award for Blue Cross's work in diversity, equity, and inclusion. We have been committed to this work for many years. At Blue Cross, we see healthcare as a social justice issue. We're proud of the fact that our company helped make Massachusetts the first state in the country with near universal healthcare coverage, the first state where healthcare is considered a right. And our work continues today with a renewed sense of urgency in every area of our business, from our hiring practices to our board, our community work, and how we care for our members. More than half our board and senior leadership team are women or people of color. A diverse board and leadership team set an example for the rest of the company. Our diversity is one of our strongest competitive advantages. Studies show that the most diverse and inclusive companies are also the most innovative and successful in the long term. We have seen that at Blue Cross, where our commitment to diversity, equity, and inclusion has made our company a better place to work and improved our ability to serve our members and the wider community. In the past year, and in the face of increased social unrest and a pandemic that has laid bare the racism that still exists in our healthcare system, we have renewed our focus on equity. We are providing grants to support not-for-profit businesses led by people of color. We're making new investments in minority-owned businesses. We have launched a first-to-market approach to collecting race and equity data so that we can identify and address inequities in the care our members receive. Equity is central to our strategy and written into our mission statement. And we're committed to making sure the focus on equity is woven into everything that we do. I am proud and honored to accept this award on behalf of Blue Cross Blue Shield of Massachusetts. Thank you.
Hello, my name is Ann Giovannoni, and I'm Vice President Corporate Counsel for Alchemies, a global biopharmaceutical company developing innovative medicines in the fields of neuroscience and oncology. I'm thrilled to be accepting the Boston Club's President's Recognition Award today on behalf of Alchemies. We are proud to be the first recipients of this award and are honored to be accepting an award alongside Blue Cross Blue Shield, an industry leader in healthcare that shares a similar mission to ours of creating healthier communities. This award is especially meaningful to us because it recognizes Alchemies' commitment to diversity, inclusion, and belonging, and the importance that we place on the development of women leaders in our company. We recognize the valuable insights, perspectives, and contributions that women have made to our business, and we are proud to have had continuous representation of women on our board of directors for over 10 years. The Boston Club's mission of elevating women to leadership positions, and specifically to increasing the representation of women on corporate and nonprofit boards, is closely related to our core value of respecting each voice. This core value is at the heart of our diversity, inclusion, and belonging efforts, and we are working to foster a culture of equality and compassion in our workplace, with our stakeholders, and with our corporate partners, such as the Boston Club. I'd like to thank the Boston Club for this recognition on behalf of Alchemies, and to thank my fellow colleagues for your support of our diversity, inclusion, and belonging efforts.
Good morning, and congratulations to all of our award winners. My name is Carolyn Ferguson. I'm a member of the Boston Club's Board of Directors and the chair of the club's program committee. This event is the result of the work of many individuals, and their contributions have been invaluable. I'd like to offer a heartfelt thank you to the committee members, to my fellow board members, and to the staff at the Boston Club for their commitment to bringing us together in this new virtual environment. Joining us this morning are three distinguished women who have made significant contributions to our communities through their leadership in healthcare. We have Dr. Paula Hammond, who serves on Moderna's Scientific Advisory Board and chairs the Chemical Engineering Department at MIT. Dr. Joanne Conroy is the president and CEO of Dartmouth Hitchcock Hospital System, and not only oversees the administration of care to New Hampshire, but also leads the next generation of doctors at New Hampshire's only academic health system. We also have Dr. Sandhya Rao, who is the Chief Medical Officer at Blue Cross Blue Shield of Massachusetts. She serves as a connector between the people of Massachusetts who are supported by Blue Cross Blue Shield, their healthcare practitioners, and the employers of Massachusetts who offer their employees health coverage with Blue Cross Blue Shield. Our panelists represent 3 of many perspectives on the future of healthcare, and here with us today to discuss the innovations in policies and practices as we start to embrace the realities of post-pandemic life. Thank you all for being here. I was hoping that we could start by having you introduce yourselves and say a little bit about who you are, and if it's possible to say a bit about the work that you've done over the pandemic. Dr. Sandhya Rao, can I start with you?
Yeah, sure. Thanks, Carolyn, and thank you for having me. I'm really honored to be here. So I joined Blue Cross Blue Shield of Massachusetts as the Chief Medical Officer in December. Actually went through a career change over the course of the pandemic. I am a primary care physician by training. I trained and practiced here in Boston and practiced within the MGB system. At the time that the pandemic hit last March, I was actually working for a startup called Haven, which was founded by 3 large national employers. One of them is Amazon, the other JP Morgan Chase, and the third is the Berkshire Hathaway portfolio. And these 3 companies came together to really reimagine the healthcare experience for the people who work there. And so at the time of the pandemic, I was actually exploring the question with primary care providers about how technology and virtual technology can engage a broader set of people in primary care in a more, person-centric way. And as we all know, when the pandemic hit overnight, the whole delivery system had to completely retool to be able to take care of people in a lot of different ways, one of which was virtual care. And so through that role, I was able to see a couple things. One is the commitment and passion employers bring to really taking care of people through a crisis. And the other was on the provider side, seeing this transition. And I was working with a group of physicians who were lucky enough to not rely heavily on visit-based revenue, and it also dabbled in virtual care before, and they were able to really transform overnight. I think we know that that was a mixed story across the country, where a lot of practices really got hit by the economics of the pandemic, and that a lot of face-to-face care was suspended. Through the course of the pandemic, and leading up to it, I would say I started thinking about the role that a health plan can play in redefining the experience for people, in that listening to these employers and thinking about the concepts they were really raising, the complexity of the system, the surprise affordability issues. I started thinking about the way a plan embedded locally in a community, really working closely with providers and employers, may have more influence over that experience than any single employer could on their own. And that's really what drew me to look in my own backyard at this role, to be in a clinical role at a health plan. At the plan, I started right sort of on the eve of the vaccine rollout. And the things that I've been excited about that we've been able to do is use data in partnership with the state. We have registry data so we can see where our members, who's getting the vaccine and who's not, and do targeted outreach, both on an individual basis, but also at the community level and with employers to get people engaged in getting the vaccine. We've also been able to support providers through the pandemic. And then, we're also really thinking about the community and working on issues like transportation and home-based delivery of the vaccine. I'm excited to discuss with Paula and Joanne some more issues about the future. Thank you.
Thank you very much. Thank you. Dr. Conroy, can I ask you to tell me a little bit about yourself and say a little bit about the work that you've done over the course of the pandemic?
Sure. Thanks, Carolyn, for inviting me to participate. So as head of Dartmouth Hitchcock Health, we have over 6 organizations, are the largest employer in this private employer in the state of New Hampshire, and deliver more care in New Hampshire than any other healthcare provider. It was very interesting early on in the pandemic that we were scrambling. We had the first case in New England up here. It was actually at the end of February. And as we kind of activated our incident command, we realized immediately that no matter how well organized and well funded any system is you couldn't do this alone. You really had to reach outside the walls of your organization. So we worked with the New Hampshire Hospital Association and got them to start gathering data across every single hospital across the state so we could assess the resources, numbers of ventilators, ICU beds, number of COVID patients, people under investigation. So we knew on a day-to-day basis, and we actually met 3 or 4 times a week as an entire organization to identify where the needs were. And we shipped ventilators across the state. We actually accepted patients from other areas of the state because we have the quaternary care capabilities that are needed in some level of care. We stood up a lab, so we helped back up the state lab. We forget that we were sending samples to the CDC. I mean, we were sending them to Atlanta. And, you know, it's almost inconceivable that we could do what we have accomplished without actually having state-of-the-art capabilities right in the state. And finally, a little shout out to Geisel School of Medicine. They actually had developed a process to stabilize the amino acid protein in the spike protein that actually was licensed to Moderna and Pfizer so they could actually mass produce the vaccine. And so, you know, a lot of work went in, you know, months before we actually started vaccinating people and seeing the end of this or light at the end of the tunnel. It was really contributed by kind of multiple leaders across the states of New Hampshire, Vermont.
Excellent. Thank you. Thank you for all the great work that you did. It's excellent. Dr. Paula Hammond, can I turn to you next?
Yes, and I'm also really excited to join this group and talk about the impact of both the healthcare system and technology in the pandemic. So I'm a chemical engineering professor. I am definitely on the academic side of things, and I work on technologies that include delivery materials for drugs. And a number of the things in my own lab that we focused on include the delivery of siRNA and mRNA for a range of different therapeutic applications. I'm on the far end in terms of applied research that is looking to be translated in the future. However, I'm also very honored to be a member of the Scientific Advisory Board for Moderna. And this has given me a very interesting lens during the pandemic. I should also mention that as the department head of an academic department that also explores a number of biopharma manufacturing advances, I've also seen advances that are growing from academia and translating out into the medical world. One of the interesting perspectives is simply the speed at which we were able to develop the vaccines. And I'll focus on the mRNA vaccines because that's where my own personal experience lies. But there's also wonderful stories around the J&J vaccine and a number of others that are protein-based. For the mRNA vaccine, one of the real technological advances is the idea that you can take the code for life, essentially DNA or mRNA, which is encoded from DNA, and use that as a way to program cells to generate the protein that is needed for a vaccine or for a therapeutic application. In the case of Moderna, I've been on the Scientific Advisory Board since 2017 and had been able to observe the development of the technologies needed to deliver mRNA to the right parts of the body. Because mRNA is a delicate molecule, it can't simply be introduced and survive. Moderna had done an outstanding job in advancing mRNA technologies by not only stabilizing that molecule so that it could actually exist in the body for long enough periods of time to have impact, but also in developing ways to deliver mRNA to regions of the body that would allow the production of proteins needed for a vaccine. So a lot of this work was going on for other kinds of vaccines. And Moderna had already lined up clinical trials for mRNA vaccines for more rare or less well-known diseases. When the pandemic came down, There was rapid speed, and Joanne referenced some of this huge coordination across scientists around the country and the world. The sequence of the COVID vaccine was made available in the early days of the vaccine from China. And that sequence was then examined. And researchers, such as the researchers at NIH, NIAID, were able to determine the key sequence that would give an immunogenic response, because you simply can't manufacture the entire virus using mRNA. You want to have a focused part of the virus that is going to be generated and is going to elicit that immune response. So that work was critical. Once the sequence was known, Moderna had already begun the process of scaling up the mRNA production. And that production was then rapidly scaled for clinical trials and ultimately put into clinical trials over a period of a few months. In fact, the first mRNA vaccines to test in animals were available a few weeks after the sequence that was immunogenic was determined. So it was a wonderful collaboration. And I think there's a real reason to cheer scientists and clinicians across the world because of that development. But what that means for the future is that we have opportunities to develop vaccines much more rapidly. The other thing that I was able to observe from where I stand in the chemical engineering department is the advancement of biomanufacturing. In our own department and in many places around the world, there were developments which helped to advance the rate at which we translate a vaccine idea or concept to an actual vaccine. And I've seen that development happen both with proteins and with mRNA. And finally, I've also seen advances in testing. And we saw how important testing was in those early days. The ability to apply technologies to get rapid testing has been really amazing.
I'm so energized to hear all three of you speak. And I think how fortunate are we to have all of you here today. When we have, Paula, you used the term rapid scale. I don't know if there's a better way to describe the way in which we've been able to distribute this vaccine. And mRNA, I think, just provides so much hope in the sense of what else can we use mRNA to do and to ultimately improve the quality of people's lives. So that's really exciting. Dr. Sandhya Rao, you are in such a pivotal role right now as the connector. You talked a little bit about working with the state, which is also really exciting. And I really look forward to diving into each of these areas and being able to pair your perspectives side by side. Dr. Conroy, I'd like to start with you and ask a little bit about your leadership. You alluded to it in your introduction, but overseeing the hospital system and also the academic institution, the largest in the state of New Hampshire. Tell us a little bit about how you've been able to collaborate and what your leadership has meant to the people that are touched by the Dartmouth Hitchcock hospital system.
I think the first thing to acknowledge is that when we started on this journey, people were afraid. It was this kind of sense of the unknown. And having been through a few hurricanes, earthquakes, and fires, I know the things that actually drive employees and individuals to continue to go to work and provide important service when they feel at risk personally and at risk for their families. I realized, through a number of floods in South Carolina, that you have to make sure that people's family, that they feel their families are safe. And so we got as much information out to our nurses, our physicians, all of our staff across the health system immediately, and we communicated incessantly. Everything that we were learning, we translated very quickly to understandable communication, not only within our health system, but we actually made an effort of communicating outside the institution. So we started Facebook Live. We actually took out ads, really educating people about the importance of wearing masks, even before the state had a mask mandate. And I'm not sure we were really popular initially because I think there was a lot of controversy over, the impingement on people's rights, but we said, no, this is actually a public health issue. It's not a political issue. Let's all get out there and start wearing masks. And I would say our employees felt they were always incredibly well informed about what we knew. I think the second thing is just acknowledging that employees were, I'm afraid for their families. When I hear about people's process to actually protect their families, dropping their clothes in their garage, taking a shower, having different sets of clothes so they didn't cross-contaminate their homes, you realize how important that drive is to protect themselves and their families. So I would say kind of communication and openness to really appreciate what people are going through was the key characteristic of an effective leader during the pandemic. And now as we're shifting to post-pandemic life, there are many other things that we have to consider. And I believe there's some things we learned through this pandemic that will carry forward. Remote work, fast decision-making, getting rid of bureaucracy, things that we just have to figure out how to integrate into our operating model.
Absolutely. And that's a little bit what we're here to talk about is what do we want to see stay? What policies and practices are going to lead us into this post-pandemic life? And to go back to something that, Paula, you had said about the future of mRNA and the way in which we were able to scale the delivery of vaccines is just remarkable if you step back. And I've heard from so many people as they've been receiving their vaccines, just how grateful they are to the field of science, the scientists that made this happen. So I'm wondering if you could tell us from your really up close view into the ways in which medical manufacturing and advancements could transform how we deliver healthcare in the future. Are there things we should be looking at to support not just science, but supporting that we get that science into the clinic and into the public?
Absolutely. I think that this really demonstrated the ability to take a scientific idea and move it all the way to help greater humankind. And there are ways in which we can accelerate that process. I think that, first of all, the ability to fund fundamental research that leads to these developments is really key. We can't forget that that is where all of this understanding comes from. And the idea that that we understand mRNA and how it behaves as a molecule and how to stabilize it, those came from experiments that weren't really directed specifically at health, but at trying to understand the nature of messenger RNA. That led to the concepts that ultimately gave us the founding of companies like Moderna that we're looking at, let's see if we can turn this into a vaccine or a therapeutic. I think that some of the things that can accelerate that process include looking at the way that we structure our federal funding and our review process so that we enable a degree of credit and process toward translational activities, as well as the very critical research activities that we have going on right now. And some of that means allowing partnerships and allowing a more applied approaches to be addressed by our National Science Foundation and NIH. And I think there are discussions about this. I think that some of the ideas that are coming up include ways in which we can integrate clinicians, scientists, engineers together. And that is going to allow ideas to flourish more rapidly. Also, there's a huge promise with mRNA, and you asked about a glimpse into the future. mRNA can encode for any protein. And the idea then is that for a number of disease states in which, for example, we want to introduce a protein that is dysregulated, that isn't available in the body at the right concentrations, we might be able to program cells to do that through the delivery of mRNA. We might be able to address not only vaccines, and it is worth noting that for any sort of infectious disease in which we understand the immunogen, now all of a sudden we can just program that in and rapidly put out a therapeutic that has already gone through an FDA process for essentially the nature of the molecule and the packaging. So that's amazing, because in the next pandemic, we should be really primed. The system is very primed to be ready. But along with vaccines for infectious diseases, including some of the more difficult ones like malaria and dengue, there are possibilities for treatments of neurodegenerative disorders, for example, more effective treatments for a range of autoimmune diseases and other kinds of disorders. And the idea is that by understanding how to more effectively direct where mRNA goes and how long it is presented, we can actually get there. I think that broader picture of how to essentially accelerate the translation of these ideas is something that we should continue to have a conversation about. We should bring people together who don't ordinarily spend as much time together, including the clinicians and engineers with the policymakers. And by doing so, find pathways that allow us to not only develop drugs more rapidly, be more able to get them through the FDA with the proper steps earlier on, move things along, and ultimately the manufacturing of these therapeutics, because that you heard a lot about being able to make enough vaccine for the world. I think that manufacturing is an incredibly important aspect of our nation's growth and of the global availability of therapeutics. And there are advances in manufacturing that rely on things like chemical engineers and mechanical engineers, et cetera, to be able to develop the technologies that will allow us to do that scaling.
Excellent. That's great. I really, truly look forward to all that mRNA is able to do for us going forward with some of the things you mentioned, malaria and autoimmune disorders, for example. One of the things that you mentioned was the partnerships and connecting people that don't normally connect together. And that's so valuable. It's another element of diversity, really, bringing in different perspectives and being able to work together to find solutions to some of the problems that exist. And I'd like to ask Dr. Rao now, as you were at Haven and then later when you joined Blue Cross Blue Shield of Massachusetts, you, in both cases, play that connector piece. You are establishing partnerships, like you mentioned, with the state, and as you've told me before, with the employers who offer Blue Cross Blue Shield to their employees. I'm wondering, through your experience, what are some of the ways that we manage and run healthcare and how they might be able to change as a result of what we've learned?
Yeah, I mean, I think what we're going to see from this moment is the amplification of three big concepts in the delivery of care that were alive before the pandemic, but I think the pandemic has really brought them to life. One is the setting in which people get care. I think we've all discovered that there are new and different places to get all kinds of services, such as your own home, virtually or in your home. And these concepts were alive before, but the pandemic has really brought them out. So where you get care. The second is the way in which patients engage with care. Previously, generally it's been episode-based, visit-based, episode-based as needs come up. We are, as we think about preparedness for other public health emergencies, we seek ways for people to really engage in a more fluid and longitudinal way with the delivery system. And so moving from 2.5 visits per year to a deeper level of engagement with primary care physicians, for example. And so you think of digital and other channels of ways that patients and providers can come together. The third is the use of data to move from reactive models to more proactive models. So, and that is, where different pieces of the ecosystem can really come together to use data to understand where we have pockets of communities that are vulnerable, where certain individual factors may make people more vulnerable, so that we can proactively act on situations. And so you could ask, where does a plan and employer fit into this model? The way in which the health dollar is spent drives a lot of this. And so moving away from fee-for-service, visit-based transactional payment to something that's more holistic, where delivery systems like Joanne's are paid on a global basis where they are rewarded for advancing outcomes, they're rewarded for finding efficiencies, rewarded for creating a better experience, moves us away from locking providers into sort of visit by visit revenue generation to a more holistic way of taking care of groups of patients. And so as employers seek a better experience for patients, plans are in that position to engage providers in these new ways. The other thing I would say is, and I think Joanne really said it eloquently, information is so critical during a crisis. And as Paula talks about where technology is going to take us, should we need boosters, et cetera, we have found being in the middle of that and being able to empower employers with information about what's happening through our partnership with the state on a day-to-day basis, really trying to understand where the vaccine supply was. We were able to provide and are still able to provide employers with information that helps them support their employees. So we've been doing webinars and things with thousands of people attending because the appetite for information is so intense as things are so dynamic. And I don't think that's going to change for some time. I really don't. And I think it might have hopefully woke people to the power we have when we have information that can advance our own health. And so we've really found a wonderful partnership, both with provider group, the public health sector, and being able to be a conduit to employers who, again, really, employers see employees every single day. Doctors don't. People walk through or virtually, but they are engaging with their workplace. And so it is a very powerful context in which to advance health. And so being able to provide that sort of flow of information, I think has really opened up a lot. And so
Absolutely.
I see that as a silver lining here in this pandemic.
Absolutely. The transparency is key. And Joanne, you talked about that too in communicating with your employees themselves. And maybe Sandhya, can we take this one step further and talk about the employer's role and payer systems like Blue Cross Blue Shield and how they contribute to the broader public health and how for example, I know that the Blue Cross Blue Shield bikes were offered for people to get to their vaccine appointments, and that I see as something that supports the larger picture of public health systems in this area. Can you tell us a little bit about what Blue Cross Blue Shield's, what you believe the role is there and where you see that expanding in the future?
Yeah, absolutely. In addition to what we do to engage with providers, we work deeply with the community to identify, where there are barriers. So in the case of the vaccine rollout, we've been really working in partnership with community leaders who share with us what barriers would be. And transportation certainly has been one, as we've seen with the distribution of the supply of vaccine. The vaccine is being given at certain sites. And so we have partnered with community-based organizations to be able to provide free transportation to folks who have that as a barrier. The other area we're looking at is the homebound. There are groups of people who cannot leave their home and need the vaccine brought to them. And so our state has created a program. And so we are reaching out through data we have algorithms to identify members who are vulnerable to missing the vaccine for this reason and are reaching out to them one by one to call and connect them to this program. And then in terms of the bikes, as we think about the mass public and how to get to these sites, we were fortunate that we already have a partnership with that program and have been able to provide that for free. But the core principle here is we really work in partnership with community leaders who see the issues on the ground and come to us to tell us what, advise us on what role we can play. And I think this is will be an ongoing journey.
Mm. The data possibilities here are really cool. Your use of algorithms, especially one of the things that we focus on here within the Boston Club is really bringing together all of the communities that exist in this area, whether they are in the center of Boston, whether they are out in different parts of Massachusetts, for example, New England, and now we're seeing more of a global footprint, which is amazing because why wouldn't our content be available to those who want to take advantage of it? And so, how do you see data transforming the way in which you deliver healthcare across the state?
So we have been thinking a lot about how we can use data to anticipate needs on an individual level, early enough where we can intervene and support. One of the sad truths about the health system right now, which I hope we all work ourselves out of this problem, is that it is so complex that, one needs their own sort of ally to get through the system and help support make decisions about the right setting for care, the right type of provider. And so we think a lot about how we can use the data we have in partnership with providers to anticipate needs and proactively support members through the system. The most active example of that right now, as I mentioned, is the use of the state's vaccine registry. This is a registry that has existed for a long time, where all of us, as we get vaccinated, the state monitors. This is the first time we as a plan, it's the first time any plan has been able to take that registry and be able to use it to identify people who are currently eligible for the vaccine but have not received it, and be able to send out targeted messages. They're on an individual basis or through email, and then really monitor. And hopefully as we go through future cycles, if we need a booster, for example, we'll be able to reflect on the patterns we saw through that data through this round to understand what are the drivers of whether people get the vaccine or not. In the next go around, be able to really understand on an individual basis who's at risk for missing it.
Excellent. And Dr. Conroy, I wonder if you have a perspective on how you see data involved in the administration of care, more in a forward-looking way, but also when there's a crisis at hand. In the moment, how will the use of data better impact the delivery of healthcare to the people that need it most?
Across Dartmouth Hitchcock Health, we actually have one EMR, electronic medical record. And when New Hampshire started to kind of cohort individuals in terms of their priorities for receiving the vaccine, we actually would upload files of at-risk individuals. So they actually then were able to schedule their appointments. That you have to do that with a partnership between the state and the health systems in order to make sure that people got vaccinated very quickly. And frankly, New Hampshire is doing pretty well in getting people actually vaccinated. But we also played a big role in educating people about the vaccine, because they would call their providers, even though the state ran most of the vaccine clinics. So, we basically were important partners with the state in getting the right people vaccinated. I would say, though, that let's look forward. We are realizing that behavioral health is one of the biggest issues we're facing post-pandemic. And we have almost 16,000 employees. And so we actually can look at our employee data, and layering on all the behavioral health challenges that the pandemic has created. We know when we look at our employees as those people that have depression on top of a chronic disease, actually spend more healthcare resources than people that don't. I mean, it's amazing. And if you have a pain syndrome on top of it, it's almost 10 times. So how do you identify that cohort of people and actually reach out to them proactively? We have decided that we're going to invest in a behavioral health infrastructure for our employees, so we can actually demonstrate to the community that there's a return on investment in this. And we're assembling a healthcare team that will use a combination of face-to-face and virtual, but 80% of our behavioral health is still virtual. And the no-show rate is incredibly low. You realize that you meeting our employees and our patients where they are has a much better outcome in terms of managing their behavioral health needs. And we're going to actually start this with our employees to offer a much expanded opportunity for them to receive care. And then we're going to actually be able to track within our own health plan, because we're self-insured, what the impact of that is on ED visits, progression of their chronic disease, et cetera. It's those interventions that are going to, number one, deliver greater value for the healthcare dollar, and number two, inform us about how we have to change our operating model, which will have to change as we move from fee-for-service to really more outcome-based payments.
Absolutely. And I know, Sandhya, behavioral health is something near and dear to you as well. And we've talked about this in the past. And I wonder if maybe you'd like to share a little bit about the way that you view behavioral health and integrating that and really taking on this digital health that we've embraced now because of the pandemic, and maybe using this, Joanne, to your point, to really bring care to those that need it most. Sandhya, do you have any thoughts to offer on that?
Yes, I can underscore, what Joanne has said. The importance of addressing behavioral health had already been demonstrated pre-pandemic, in particular amongst populations of people who suffer from chronic disease. There's a compounding effect of untreated behavioral health and untreated chronic disease that really shows up in medical expense, but you can understand how the two interplay. How can you take care of a chronic condition that requires so much of people to change behavior with an untreated depression or an untreated anxiety? So we have been, and then the other major contextual issue here is there's a gross mismatch of supply and demand in terms of resources to treat behavioral health issues. So we've been thinking about that for some time and taken some actions to increase capacity, bring more providers into the network. That sometimes involves payment. The other is actively in the pandemic is to make sure that virtual therapy was available. And we have seen, 70% of behavioral health services currently are being offered virtually. About half of overall virtual visits right now are in the area of behavioral health. So we are committed to that because I think, as you mentioned, Carolyn, it is a major barrier to the treatment of behavioral health issues, which are very visit intense, is the idea of someone taking off from work and going physically to another place. So I think Joanne's absolutely right. These no-show rates are really dropped as the virtual channel has opened up and created this, this ability to get care. The other thing we're thinking about is not all behavioral health treatment really needs to be visit-based. There are other modalities like asynchronous and even self-service. So one thing we did early on in the pandemic is provided all of our members with a asynchronous sort of self-support tool that is meant to address the various forms of lower acuity behavioral health issues that are really pervasive across the population, affect us all day to day, and that require a different type of approach. And so we are really thinking now, we're stepping back because we are still seeing that despite these actions we've taken, there's still a mismatch in the supply and the capacity to treat. So we're looking at different solutions, technology driven, and ways to really support the providers in our network and providers in our community who want to be there for people. And what can we do as a plan to support behavioral health therapists so that they have the capacity that is really being asked for at this time? And what is spoken about less is the pandemic has surfaced a need for pediatric behavioral health services, adolescents in particular. So we're partnering with an organization called Brightline that provides virtual family-based treatment specifically targeted to kids.
That's great. I mean, to think of what a elementary school age child has gone through, not being able to have that same social network at school and going physically to a school. I mean, that certainly takes a toll considering they haven't been able to really build up the resilience that an adult might have. So that's huge. And maybe speaking to that, I know, Sandhya, you are a mom as well, and changing from Haven to Blue Cross Blue Shield with some little ones at home. What would you say to those who are with us today, who are doing something similar, trying to advance their careers, but also trying to balance that family life and, potentially changing jobs in a career as you did?
Yeah, I would say certainly to this group, that's really the mission of this organization is to advance women. I would, to be very honest, in the early stages of the pandemic, I thought it was very, very hard. My children were at the time 7, 4, and 2, and we did not have childcare. And so for me, I thought very hard actually about dropping out of the workforce for a brief period of time. I was really feeling like I could not turn in the level of work that the quality of work that I had been used to. I felt like I was at a sort of B-, C+, because huge chunks of my calendar said, teach homeschool. And the way that my partner and I dealt with it is we split the day in half, and one of us would run homeschool in the morning and one of us would work, and then we'd stay up late to make up for that lost time. And so we felt like the quality of work we were doing was poor. And then the feedback we were getting from the kids was that we weren't really doing great at that either. So, I really did worry that I was going to hurt my brand, and sort of my work was so bad. Why don't I take a break and just focus on this one thing and come back? And I will tell you what really gave me the courage and confidence to make the career change that I really was interested in making was women who supported me at work. My boss and the women around me, many of whom did not have children and, weren't having the same personal experience, but really empathized. And we had a culture of openness where you just, shared what's actually happening. And people said, we'll support you. We'll all be there for you. We're going to get through this. And it made a tremendous difference. And I was someone who wouldn't have really shared those struggles pre-pandemic. I don't know if anyone can relate. I just sort of kept that stuff to myself and kept working. And my boss really drew it out. It was like, let's just talk about what's actually happening. And it made a tremendous difference and kept me in the game. And I wanted to make this move, and it gave me the confidence to jump into the interview process and go for it. And I hope to pay that forward. It was truly transformative. And I encourage people to speak up about what you're really facing. And I think that's another silver lining in the pandemic is I find people, I'm 6 months into a job, I feel closer to my team because people are really giving more and sharing more about the reality of the context of what they bring to work. And some of which was stuff that people were dealing with before the pandemic. It's just been normalized to talk about the context of the whole person that you are.
Mm-hmm, mm-hmm. Absolutely. And I really hope that you do pay that forward, and because you will demonstrate it when you do, and we will have more colleagues and friends like you to ask how it's really going and to support where needed, because it might not always be obvious that that a person needs it outwardly. So thank you for that. Thank you, and I'm sure that your teams are so grateful to have you in there as their leader. And we've talked a little bit about leadership this morning, and I'd like to bring it back to Paula if I can. You've said before that we are at a renaissance in medicine and biotechnology. I'm wondering if you could share a little bit about what you mean by that and what we can expect in the future of medicine and public health.
Absolutely. I think there are so many enabling technologies, a number of which have been developing over the past several years, but a pandemic brings things together. And when I was listening to Sandhya talk about the ability to transform healthcare, I thought about how technologies might be able to facilitate some of those things. For example, we already are familiar with the fact that in-home diagnostics have become more common, but technologies can enable us to much more effectively enable technologies that allow patients at home to do something like a simple paper strip test or simple monitoring, digital or otherwise, that will provide them and their primary care physicians with information that could alert them to problems, could help inform just the regular check-in, and give the kind of quality information that typically requires that you go in and you get many tests done. And I think this is something that is going to happen in the future, but it's definitely on its way. I know as a patient, for example, that some of the things that I would hesitate to do would include things like the regular sort of cholesterol blood tests, these kinds of things. I think that there are technologies that are becoming much more available to us that will allow more of these things to take place in the home in a routine fashion without having to take away a part of your day, a precious Saturday morning or weekday afternoon, that is going to enable patients and physicians. I also think that there are ways in which we can get rapid manufacturing that I mentioned before, outlet, which will allow us to approach new and oncoming diseases much more effectively. And I really think that renaissance is going to happen when we begin to integrate monitoring technologies with the availability of data. And we talked about data just a minute ago, but the ability to have the quality of data that would allow us to begin to make correlations that would give us an idea of patients who may be showing preliminary evidence of a condition that could be readily corrected and changed, that would be incredibly enabling. Machine learning has been an amazing tool, and it's being applied now in the public health realm. For example, machine learning has been applied to the understanding of the genetics of large numbers of cancer patients to determine potential targets for cancer treatment. But the same kind of data or quality of data applied to everyday patient diagnostics could help us understand whether or not patients might be taking a path toward a high blood pressure situation or a stroke situation, and would allow physicians to be able to detect that, because by essentially mining large amounts of high quality data, we can determine who those susceptible populations are right away and begin to apply preventative measures that are really quite adaptive. And that's where I think we begin to change things. It's when we are not only using these kinds of advances to treat those who are sick, which we absolutely need to do more effectively, but to actually prevent sickness, right? And that's where I think the excitement is. Machine learning, rapid diagnostics, the ability to use mRNA and other kinds of technologies that rapidly transform knowledge to a therapy. All of these are going to converge. And I think being able to interact more closely with the doctors, with the clinicians, with the patients, and with the healthcare systems that deploy these tools, that will allow us to create a structured way of generating this data and then using it in a way that can actually be helpful.
Absolutely. I love that talking about preventative healthcare, whether that's, you know, a meeting you have with your behavioral health specialist every other month, or maybe it's, you know, seeing your doctor for a virtual physical that, you know, isn't in person every year, but on those off years, maybe you could do something like that. I think, especially for women, there's an element of caregiving that comes that comes to us naturally. Sometimes it's hard to prioritize ourselves, right, and make sure that we are getting the care that we need. And so making the best use of this virtual health and telehealth model could be a way to actually make sure that we are preventing any large health challenges coming our way from even happening. So
Absolutely.
Yes, I really appreciate your thoughts on that. We have with us today Angus Chen, who is a reporter at WBUR's Common Health. And Angus actually focuses on healthcare. WBUR's Common Health is the source for news, conversation, and smart analysis on all things health. And I'm going to bring him into this conversation today to help us moderate the Q&A that we have from our audience. So to the extent anybody on this presentation has questions, please use the tools available to ask your questions. And again, you know, really fortunate to have these three fantastic women talking about very different perspectives in the healthcare field, and really with that forward-looking landscape as to you know, what post-pandemic life is going to look like in the healthcare space, and how is it going to impact all of us, as whether that's in the corporate space, as entrepreneurs, as members of nonprofit or corporate boards. and our families and communities. So with that, I will introduce Angus.
Hi, and welcome back. I just wanted to say sorry to everyone for being late to this. I thought this event actually started at 7 p.m. Rather than 7 a.m. But welcome back to the Q&A portion of this panel. We have a couple questions that are here already. So I'd like to start with a question for Dr. Sandhya Rao. What is the role of corporations in sort of driving the future of healthcare, particularly, I guess, payers offering certain benefits or employer-sponsored care? And are there certain trends that you're starting to see clients implement now?
Yeah, it's a great question, and nice to see you, Angus. You know, what I saw at Haven and what is really being confirmed with my work with more employers at the plan is that employers are very committed to addressing not only the affordability issues that we are facing, we have an affordability crisis for sure, but we have an experience crisis also. It is chaos, and there's chaos and fears when people discover a health need. It's scary. It's scary to figure out, again, what's the next step? And then people are wondering if, are they going to go bankrupt if they make the wrong choice, et cetera. It's sufficiently complex. And so what I have learned is that employers want to fix that, and so we as plans are feeling a good kind of pressure to step up, simplify things, support members on journeys, engage with providers in ways that value, value models of care, like what we've been talking about here, virtual care, different settings. The delivery system wants to innovate in this way, and plans sit in that place as stewards of the health dollar to be able to reward that level of innovation. So what I'm seeing is that employers are really seeking that. They're excited about it. They know there are better ways to deliver care, and they're seeking plan partners who can accelerate that. So it's a very exciting time. The other thing I think, Angus, in your question is broader than the healthcare dollar going into the medical model, the delivery system, is how do you think about investments in social determinants of health and other aspects which we know drive health across the population level. Those are things like food, transportation, housing, the work setting itself, as a either supporter or not supporter of health, the setting in which people do their job. And we're finding a lot of consciousness about that. And then in this context of health equity, which we haven't talked too much about it today, but the pandemic certainly has shown where racial disparities are in the system. And we are hearing from our customers that we all need to step up and address those. And employers are really looking all kinds of partners to address that major issue.
Yeah. I mean, I guess a follow-up to that would be for Dr. Conroy. I mean, from the employer perspective, I mean, do you feel like there's resistance to any of these ideas? Is it going to be something that medical systems are going to be able to implement, smoothly?
Well, I think that historically, our healthcare system has actually had a lot invested in employer-sponsored healthcare. And that's shifting a little bit, but not as quickly as many policymakers thought it would shift. We see people that are on the exchange that actually don't have insurance through their employers, but we haven't seen a lot of employers actually move their people onto the exchange. And it's because as an employer, we have a lot invested in our employees being healthy, and we actually want to take a more active role. Now, having said that, employees have a privacy concern as well around their health records. And so you have to have a firewall where employees feel that their health records are protected and separate from their employment records. But frankly, there's something very positive about employers doing a design of a benefit plan that benefits employees. I'll give you an example. We pay for all the insulin of all of our employees. I've got like 900 diabetics across my health system, and I know that if they actually have access to their medications, they're going to have better hemoglobin A1C, they'll have fewer ED visits, they'll have better management of their chronic diseases. And so we started doing that a year and a half ago. Actually, maybe it's more like 2 years ago. Now, I know this is a long game. This is not a short game. I'm not going to see improvements in 1 year or maybe even in 2 years, but 3, 4, 5 years, I should see some improvements in my claims. And there is a way for an employer to make really smart decisions about benefit design without actually breaching the confidentiality of our employees' medical record privacy.
Yeah. I mean, this is kind of all, I guess, in the name of preventative health, I suppose. Sort of making sure that if people are healthy to begin with, you're not sort of losing out on sick time. You're not losing, later years of morbidity in your life. And I think that sort of one thing that this pandemic has really revealed is that there are new ways that we're thinking about prevention, sort of a new culture of preventative health. And this, I guess, is a question for all three panelists. But I mean, do you sort of feel like I guess, what do you think? What kind of culture do you think is sort of coming out of this pandemic that we're going to be able to carry forward with us in terms of preventative health?
Well, I'll start. I actually think that people have realized there's a silver lining on the pandemic, that there's a lot less travel, there's a lot more time centered at home. And I mean, life was pretty simple in New Hampshire to begin with, but it's way more simple now. And I think people are actually appreciating that. And we have seen people that have really embarked on losing weight. When obesity was a correlating factor for people that got very sick with COVID. We've seen people, because of all the behavioral health challenges, they've been very purposeful about creating things in their life that actually help manage the stress. And I believe a lot of that is going to carry forward. I, for one, am hoping that business travel will decrease significantly. I'm not sure I've got an appetite to go to meetings where there are 10,000 anesthesiologists. And, I hope that we appreciate the fact that we can do a lot of this virtually pretty well. And a lot of that should continue.
What I'd say is in our state, and I know for a fact that Joanne's system has adopted this too, we're about 15 years into a march towards value-based care, which has really installed a primary care and renovation, where most primary care physicians are now operating in a model with that has deep consciousness about managing chronic diseases with team members. It's not just a physician doing visits, but they've got team members with different skill sets to engage populations. They're using data to find people in their practice who are missing key preventative services. So we're actually in a very mature market here in terms of how primary care in particular is advanced towards that. I do think the awareness of the behavioral health overlay, that the pandemic has really normalized talking about behavioral health issues. And that is a big barrier, as I mentioned, to the self-work, the work that comes back to the patient on taking on some of these preventative things. It's really hard. It is so hard. And I feel, and again, even talking to employers, just the openness about the fact that this is real. Many people suffer from untreated mental illness and behavioral health issues. And so I think that's really what is going to open up and you really create a sort of new moment in terms of taking care of one's own health, that's a piece of it, that mental health is health. Will be a profound change. And then the other, I think, is going back to health equity and the fact that taking care of yourself is in your own cultural context. And I think all of the events over the past year, the pandemic and then the social unrest, I feel a much greater consciousness on the part of various sectors, it's the delivery system, the employers, about surfacing this idea that we all bring something different to the way we take care of ourselves, and it's in the context of our communities, and supporting that and really getting where people are. It's all part of taking care of your health.
I would echo what Sandhya said about really having virtual health make the visits to primary care physicians, the maintenance of your health, the awareness of both your behavioral health and your physical health, something that's much more accessible. I think that the fact that you can now use technologies, and I think technology has permeated much more of our communities because of this pandemic, means that this can be something that is available to people when they can make it convenient in their lives, when they can shape it into their lives. And one of the efforts that we really have to do is to ensure that this is available to everyone. I think it's much easier for virtual health and the technological advantages that we see from it to impact the already the communities that are already very capable of acquiring laptops and acquiring iPads. We want to make sure that the communities that struggled during the pandemic with homeschooling because there weren't laptops available or there weren't iPads available, that they have these modes of access. And if we can do that, then we can actually access communities that have been very difficult to access in the past, because now we're not worried about losing a day at work or being unable to handle childcare while also checking on your own personal health. I think that technologies can help us there. I think that we can find better ways to make virtual health available to everyone using different kinds of device platforms, as well as other technological innovations. I think that there's also the ability to make diagnostics, as I mentioned earlier, much more readily available so that the conversations that happen in virtual health appointments are also informed with more technological data. And ultimately, by accessing these broader communities, we'll have a bigger, better, richer data set, because when the data is anonymized, but we're able to then recognize patterns, we can detect problems in all of our communities that may be happening, including behavioral health problems, problems that are tending toward certain kinds of conditions, such as diabetes in certain communities. And we can begin to really be much more effective in preventing health issues in the future.
Yeah. So we have just a couple minutes left during this Q&A session. And I want to get this question in to Dr. Conroy. How are the ways that the education of clinicians, so like doctors, nurses, therapists, how does that need to change when we're entering the future of healthcare, I guess, out of this pandemic?
So the pandemic actually demonstrated that at least the component of education that we would call didactic might have historically taken place in a classroom, doesn't actually have to take place in a classroom. We demonstrated that really opening up the classrooms to kind of virtual learning allowed people to participate in a much different way. And it's actually probably a much more effective way in terms of learning at their own pace and learning with the resources that they actually need to perform. I think for rural communities, that's even more important. there are many programs across the country in rural areas where they've been able to engage students who maybe can't actually go to a major metropolitan area to do the didactic component of their work. The second thing is the clinical component. And for only a very short period of time, and we were figuring out the impact of the pandemic on education, we restricted students, but it was really less than 2 to 3 weeks, and we brought them back into the institutions after appropriate training and donning and doffing PPE, and they actually had an incredible experience to be on the front line of taking care of patients during the pandemic. I would say that we've done a lot of team training. You never have enough physicians or internists or intensivists to care for a crush of patients that need you. We did team nursing, we did team provider services. I mean, we elevated everybody's skills. So our primary care providers became hospitalists, our hospitalists became intensivists, and people did whatever they needed to do. And I think we learned that the capacity and capabilities of students is much broader than we thought. So my hope is we're going to be a lot more fluid, less rigid about both the environment in that people do their didactic training and the environment where they do their clinical training.
Yeah, I saw a lot of that in the hospitals here. Well, so that's all the time we have for right now. I'm going to hand the mic back to Carolyn Ferguson at the Boston Club. Thanks so much for all your questions from the audience, and thank you to our 3 panelists. I'm sorry I got the time wrong, but it was great to speak to the 3 of you.
Nice to see you, Angus.
Thank you, Angus.
Thank you.
Thanks so much to all of our panelists. Really had a great discussion with you today. To all of our attendees, thank you for being with us. To our production company, thank you for your partnership, Open Exchange, and Diginovations. We hope that you will continue to stay involved with the Boston Club. We have an event coming up on May 11th where we will host a panel discussing how STEM addresses education disparities, what that means for the rising generation and our economy. And also on June 15th, we'll host a panel to discuss the opportunities that are now available to us in the world of digital health. You may learn more about these events at our website, thebostonclub.com. Congratulations to our award winners again, and thank you to everyone who has made this event possible. Thanks for joining us. We look forward to seeing you again soon.
Thanks, Carolyn.
Thank you.
Thank you.